Neighly. I'm the Director of Guaranteed Income at the Economic Security Project, and I'm thrilled to be here today with Erin Coltrera and Sukhi Samra to discuss the Stockton Economic Empowerment Demonstration findings. As many of you might be seeing today, it's all over the news. Once again, we have really great, vibrant information about how cash transfers can uplift communities and what a guaranteed income means for folks who are living with economic precarity or economic instability. So I'm going to kick it over to Sukhi first, but let me introduce both of our panelists. Again, Sukhi Samra is the Director of Mayors for Guaranteed Income and the Director of the Stockton Economic Empowerment Demonstration. It was the nation's first mayor-led guaranteed income demonstration. She was previously a policy aide to Mayor Michael Tubbs, the mayor of Stockton, California, who led the SEED demonstration, playing a critical role in the launch of Stockton Scholars, an ambitious college access initiative, and in publishing the inaugural report on the status of women. Sukhi's from Fresno, California, graduated Stanford as a member of Phi Beta Kappa, and she's done just amazing work both on SEED and Mayors for a Guaranteed Income, which she will share more about. We are also joined today by Erin Coltrera, who has so many degrees, which I just found out what they mean. So I'm very excited to share this with you. She is a licensed social worker. She has a master's of social work and a master's of social science policy, and I think I'm messing that one up. She recently joined the leadership team at the Center for Guaranteed Income Research at the University of Pennsylvania, which is going to be providing direct research support and evaluation for the Mayors for Guaranteed Income demonstrations. And she currently works as the Research and Program Officer for SEED. She brings a decade of relevant experience contributing to the development of complex people-oriented policies and programs. She received her Master's of Social Work and Master's of Science and Social Policy from the University of Pennsylvania. So again, I'm going to turn it over now to Sukhi to really talk to us a bit about SEED, lay the groundwork there, and then she'll kick it over to Erin to discuss the findings. I'm going to go ahead and share my screen so that I have the slides, and just let me know when you would like me to transfer them. Thanks so much.
Awesome. Hi, everyone. Thanks for joining today. I'll go ahead and just start with a quick overview of what SEED is and the work that we did on the sort of program and implementation side, and then I'll pass it off to Erin to actually go into the details of what our first year findings reveal. The SEED, the Stockton Economic Empowerment Demonstration, and Madeline, you can go to the next slide, was the nation's first mayor-led guaranteed income demonstration. We gave $500 per month to 125 Stockton residents for 24 months. We launched this in February of 2019, and our disbursements ended just a couple months ago in January of 2021. We were really motivated to test guaranteed income as a solution to poverty, and specifically in Stockton, where poverty really is at the crux of so many of the other issues we face, from poor educational outcomes to high rates of homelessness and high rates of crime. Madeline, next slide. And you can keep pressing till there's content on the slide. Yeah, awesome. So in terms of how folks were selected, the criteria and the process, so SEED by design is meant to be a very community-oriented project. We say that we want to really reverse the trend of research being done on communities instead of with communities, especially in a place like Stockton that's a majority minority city and traditionally marginalized by all sort of institutions and markets. So we did a pretty robust community engagement process. And based off of the town halls and conversations that we had with elected leaders and residents, we landed upon a pretty simple selection criteria. Folks had to be 18 years of age or older, and they had to be a Stockton resident in a neighborhood where the median household income was at or below $46,000. And we chose that number because that was Stockton's median household income at that time. So it allowed us to be targeted, but still reach folks most in need. And if you see the map on the screen, you see that most of Stockton's neighborhoods were actually eligible. From that selection criteria, we worked with our research and evaluation team to send letters to about 4,200 randomly selected households that were located in the qualifying neighborhoods. Those letters invited folks to participate in SEED and were informed that they would either be placed into our treatment group or our control group. And of the folks that responded, we randomly assigned 125 to receive the guaranteed income. Next slide. And I'll just summarize what the key research questions are before passing it over to Erin. Our key research questions, we had 3. How does the guaranteed income impact monthly income volatility? How do changes in income volatility impact psychological health and physical well-being? And how does the guaranteed income generate agency over one's future? I'll pass it off to Erin for the exciting parts.
Okay, excellent. Thank you so much, Sukhi. One of the things I just want to note before we get into the nitty gritty and probably what you guys are interested in is we've included as much information as we can on the slides, which means on some of these slides, I'll be spending, a couple of minutes, and some of them we're just going to bypass, but this way you have it to see and reference, and it's available. Madeline, could you go to the next slide, please? Excellent. So before we talk about the actual findings and our answers to those questions, we have to touch on the ways in which this research evaluation was conceptualized and designed. It's a mixed methods randomized control trial design with 3 strands. The first strand is a politically purposive storytelling sample, which was comprised of individuals in the treatment group who were made available to media, who tracked their stories over time and were participating in aspects of SEED outside of the direct research. The second strand was long-form quantitative surveys, which were collected every 6 months at even intervals, and brief text messages surveys done monthly. The third strand is qualitative data collection, so in-depth interviews, focus groups, and short-form ethnography. These were done at regular intervals with members of both the treatment and the control group, and in some cases were done in a capacity where you are using the quantitative results to drive the qualitative aspects, and in some cases were done independently. The last piece of this is that the aim of this study design is to understand the what that happens alongside the how and the why. And this is because quantitative data can tell us a lot, but it can only tell us so much because it actually takes people explaining why these things are happening and how they're happening in their lives to operationalize what we can truly take away from this. And so that is the reason for the design. This does limit the aspects of the analysis that we can talk about because the study design requires us to have married all 3 of these strands in order to provide an analysis. So you'll see some of those limitations later that we won't be able to fully answer some of our research questions until the full findings are available sometime next year. But it does give us a phenomenal window into the early aspects of it. Could you go to the next slide? Excellent. So this is a little bit of what I was just saying to give you an idea of the intervals at which the data collection was performed and the aspects of the domains on those data collection activities. You can see that in the quantitative survey, you've got income volatility, psychological distress, physical functioning, family dynamics and parenting, food security, expenditures, and hope and mattering. These are long surveys, but they take about half an hour to complete for individuals. Could you click through? I believe it's going to circle some of those domains for us, Madeline. Yes. So yeah. And it should, there we go. Okay, so these are the areas in which we have information to share with you today, and I just want to highlight what aspects of the research activities that they're coming from. Next slide. Give you a little bit more information about the qualitative aspect of this, since this is one that folks often have questions around. We performed interviews with folks in the treatment group during the onboarding process. So while they were getting oriented to SEED and the structure of this disbursements, those interviews were 20 to 40 minutes in length to minimize the amount of overload they were experiencing during that time, since the onboarding process was a lot. The second aspect of it is 50 interviews with treatment group folks. We reached out to everyone in the treatment group and stopped recruitment when we had reached our capacity of 50. Those interviews were 2 to 3 hours in length and focused on expanding some of the aspects of the quantitative surveys. We also did focus groups and community meetings in which we allowed Stocktonians who were not participants in the overall research to weigh in, to tell us what context is missing, right? What needs to be considered here, and how do we understand the information that the research is really getting at? You go to the next slide. And one more, there we go. Okay. So now we start to get to what did we actually find? And we'll start out with income volatility since it's pretty straightforward, but it's also, it's what we hoped and expected, but it's still very, very neat to see. 1 year into the program, the treatment group demonstrates less month-over-month income volatility than those in the control group. And in fact, as you can see from these statistics here, the control group experienced nearly 1.5 times more income volatility than the treatment group. In this case, we're talking about income volatility using a coefficient of variation that is the same as used in the US financial diaries. Can you go to the next slide? Okay, another aspect of income volatility that we were interested in looking at is how would folks pay for an unexpected $400 emergency expense? This is a statistic and a question that you see thrown around a lot regarding discussions of the economic state of the everyday American household. And I think what is really, truly stupendous for us to see is that the money that SEED dispersed to folks was not spent in a lot of the ways that critics were worried about, right? That it would be frittered away, that it would not actually impact the everyday lives of people involved, but that it manifestly changed the overall financial picture for our treatment households. You can see that at baseline, treatment and control answered this question roughly the same, and that 25% of the treatment group and 25% of the control group at that baseline said that if they had an unexpected $400 emergency expense, they would be able to pay for it with cash or a cash equivalent. At 1 year, you've got more than doubling of the treatment group's capacity to pay for this with cash or a cash equivalent. And the question is, why does this matter? Well, the alternatives for paying something, for paying that $400 emergency expense with something that's not cash or a cash equivalent often involve taking on debt, right? And debt has long-term consequences beyond just the initial expense, because you have impacts on credit, you have impacts on the amount of money that people are actually paying when it comes to interest. And you also have impacts on the people who they may be turning to in order to be able to pay off that unexpected expense. So this is huge for our folks, and we're very excited to see it. Can you go to the next slide, Madeline? Excellent. So as a social worker, this is a finding that I am particularly enthusiastic about. As Sukhi stated, one of the things that we wanted to know is how do changes in income volatility impact psychological health and physical well-being? In order to answer those questions, as I said before, we looked at health indicators of physical functioning and psychological distress and measured them quantitatively using two validated measures, the SF-36 and the Kessler-10. The Kessler-10 is a widely used instrument that measures psychological distress based on questions around anxiety and depression. You've probably answered it at your primary care physician's office. What we found is that over the year, recipients were less anxious and depressed, both over time and compared to the control group. So within and outside of the group, which is phenomenal and exactly what we would want to see. We also found that recipients reported improved emotional health and well-being and energy, both over time and compared to the control group. So again, this is not just about where they were at the beginning of the study, but also about how they are compared to the control group. Can you go to the next slide, Madeline? Okay, this is my PI's, this is their favorite graph, possibly ever, of all time. This is using the Kessler-10, and it is the measurement of whether or not you are experiencing a mild mental health disorder along the lines of anxiety and depression. As you can see, the treatment and control group started out roughly the same. Our treatment group actually experienced slightly elevated scores compared to the control group at baseline. But over the course of the first year and over the course of these surveys, there is a consistent decrease in the amount of anxiety and depressive symptoms that treatment group are expressing and experiencing, whereas you don't see that change within the control group. And what this actually means is that you're seeing folks go from a space where they are considered less likely to be well emotionally to a space where they are entering into emotional health and wellness and well-being. I think one of our favorite ways to talk about this is with the idea that this is akin to an effect that you would expect to see by taking an antidepressant or an anti-anxiety. But these are not pills, it's not medication, it's simply cash and the fact that it is helping to alleviate that level of strain. Next slide, please. Excellent. So the really cool thing is that this goes beyond just the qualitative measurements, and it's really borne out through the quantitative measurements, but it's borne out through the qualitative data as well. In the interviews, recipients talked about the decreases in anxiety, depression, and the extreme financial strain, and how it increased their capacity for goal setting, for coping with unexpected shocks. And those shocks are financial in nature, but they're also emotional in nature. This is one of the things that we're most interested in seeing what happens during the second year of disbursements, because obviously SEED is sort of defined by the fact that the COVID pandemic began exactly halfway through disbursements when we think about February of last year. So given that this meant that our folks in the treatment group were set up in a better position, we're interested in seeing how this carries through over time and whether or not these are sustained in that capacity. We also noticed, as the slide points out, that the $500 served as a form of paid care work that allowed women in the sample in particular, who were used to putting themselves in a position where they were the caretakers of not only their immediate families, but their extended families and their social networks, to be able to finally focus on themselves in a way that they had not been able to previously. Next slide. Okay, so the big final question that we were interested in talking about was, how does guaranteed income generate agency over one's future? And we characterized this into two separate domains, changes in employment and risk-taking, so those first two aspects, and goal setting, and the second was freedom from forced vulnerability, which we conceptualized as circumstantially coerced trust or dependence in people, social ties, or symptoms out of necessity or lack of choice. Next slide. Okay, the quantitative aspects of this are, again, really exciting from a policy perspective and from a responding to critics. One of the biggest arguments against guaranteed income that we heard repeatedly going into this and throughout the course of the demonstration was, if you give people money, they're going to stop working, right? They're going to take time off. They're not going to prioritize, their lives. They're going to use this and they're just going to fritter it away. Well, that's not at all what happened, and it's not what was borne out by the data either. As you can see here, at baseline, both treatment and control had a number of folks who were underemployed or unemployed. So at baseline, 28% of the treatment group was full-time employed and 32% of the control group was full-time employed. Over the course of that year, that shifted dramatically for the treatment group. You see a 12% increase in full-time employment. And I remember when we first talked about this statistic, the PI, Dr. West, who was in charge of doing the quantitative analysis, went back through the data because she was like, this is incredible, but what does this actually mean, right? Who got that full-time employment? Is it people who are re-entering the workforce? Is it people who are coming out of retirement? What's happening here? And what we find, tracing this back on an individual level, is that these were folks who were unemployed or underemployed, but searching for work or wanting to do more at baseline. And they were able to make that happen over the course of that first year, which is pretty incredible. Next slide, please. Excellent. So shifts in employment patterns, like the ones displayed in the previous slide, were tied to removing material barriers to full-time employment and removing time and capacity limits created by the scarcity and precarity that folks had found themselves in at baseline. Material barriers in this case include the ability to reduce the number of part-time shifts or gig work in order to actually apply for stronger positions, right? To make time to get to interviews and to search for jobs that are going to be more stable and substantial. Activities that we think about that folks described as completing in both the quantitative surveys and qualitative when they were explaining how this happened or why this happened with them included things like completing internships or training or coursework that led to full-time employment or promotions, and the ability to reallocate their resources in ways that facilitated seeking better job prospects. As you can see from the participant quote there, risk is one of those issues that folks have to navigate, and the $500 was able to mitigate it in a way that allowed them to make better decisions for themselves, right? This was not as if, we were providing employment training or, requiring them to seek employment. These were decisions that folks were making on their own simply by virtue of having that extra mental space. We did find, however, that the scale of that risk-taking and goal setting was somewhat curtailed by the limits of care work. And what we mean by that is that women in particular who had so much care work to do to begin with were not necessarily able to make the transition into full-time employment if that was something they wanted, because of their responsibilities that already existed and that the $500 could not mitigate. Next slide. So that second piece, the freedom from forced vulnerability, is also really huge. And one of the things that we talk about when we talk about experiences of poverty is that the experience of poverty doesn't guarantee the presence of a strong network and strength of ties. Rather, it means that surviving it is often about figuring out how to navigate through a resource-poor world by using the things around you, right? By using those relationships, by using those communities. But that sometimes the communities that we're forced to engage with, the individuals that we're forced to connect with, right? The people we have to ask for help, those are not people who are healthy for us, who are good in our lives. And we are forced to be vulnerable in that capacity because we have to survive. Now, chosen vulnerability on the opposite end hinges on things like agency and authentic trust. So that's where you are individually, independently making the determination that you do want to be connected with these folks, right? What we found is that the $500 allowed people to make different choices about who they wanted to be vulnerable with and the ways in which they wanted to be vulnerable. And the narrative data really underscored these dynamics and illustrated how living with constant financial strain created forced vulnerability, dependence, and trust in people that they really didn't want to engage with, or with systems that invited unwanted surveillance into their household, right? When we're thinking about the benefit structure and whether or not people choose to go after existing benefits like welfare. Next slide. Okay, I want to turn this back over to Sukhi at this point to talk about some of the implications of the findings that I've just shared with you.
Awesome. So in terms of implications, especially as we scale out, for folks who don't know, SEED has sort of scaled into this bigger movement called Mayors for a Guaranteed Income. And we are sharing a lot of these implications as we're providing technical assistance to about 40 mayors across the country launching guaranteed income pilots of their own. The first implication is around sort of the idea of trust. Guaranteed income demonstrations really are an exercise in building trust, especially with marginalized communities, folks of color, communities of color. And we saw trust impacted everything from engagement to take up to spending patterns. When we originally did our address-based sampling and we sent letters out to folks, we heard anecdotally from a lot of recipients who came in and folks who called the line later saying that they just didn't believe that government would be willing to give something for nothing, and that this wasn't an idea that was actually going to stick, that this wasn't going to be predatory in some way, shape, or form. That also drove spending patterns because for the first, even though recipients had come in and met with myself or met with someone else on staff, they still, at least until 4 or 5 months into the demonstration, they didn't believe that the guaranteed income would be here to stay. And so they were more likely to transfer the money off of the card or more likely to transfer it into their own bank accounts. We also see in the data that there are real structural limits of guaranteed income. Since we launched SEED, we've been very staunch in the belief that a guaranteed income is not a panacea or a silver bullet. It's meant to supplement, not replace the existing social safety net. And it's just one of several progressive policies that needs to exist. We, with just $500 a month, saw that recipients were not able to address the cost of housing, cost of childcare, lingering cost of healthcare. Not because these costs didn't exist, but because the $500 a month just wasn't as significant in terms of being able to drive those costs down. And again, in terms of sort of the policy implications, guaranteed income really is meant to be one of several tools to provide an income floor to folks. And on the slide, you'll see a quote from the same recipient, from one single recipient, sort of talking about how trust influenced the way that she interacted with the program, from recruitment to onboarding and the distribution of the prepaid debit card to engagement at the 4-month point with Erin, actually, who's who was responsible for retention and the treatment. And so again, at recruitment, she didn't believe that this was real. She thought it was a lie. For onboarding, she was so anxious. She wasn't sure if the debit card was actually going to load. And then for engagement at 4 months with the research, when Erin went and dropped off a prepaid debit card, a gift card for participation in the research, saying, maybe I won't make it back alive. So again, just really noting that trust really was at the center of everything that we did. I think that's it.
Yes, thank you so much. So that was the full presentation. The slides will be available. I'd like to open it up. I see that there weren't really questions dropped in the chat, but I'm sure there are questions from our crowd. If you'd like to turn your camera on, makes it a bit easier for a conversation, please just raise your hand and I'm happy to call on folks to ask Erin and Sukhi anything related to seed. Tom, do you want to ask your question? I'm happy to have you unmute and ask.
Sure, thanks. Can you hear me? Yeah. Yep.
Yes.
Great. Yeah, I'm just curious. Usually in the context, I was curious about your targeting in terms of the different neighborhoods and the income levels that you were looking at. I was just curious if there were other options for targeting that were explored, or did you just come up with that and move forward?
Sure. So as I mentioned, we did a pretty extensive community engagement process at the very beginning of the demonstration, which is how we landed upon the selection criteria that we did. We did for about 6 months. We held town halls. We talked to community leaders of like nonprofit executives, heads of public health agencies and the San Joaquin County Housing Authority. We spoke to residents themselves and we asked them sort of what parameters would you like us to design around seed? And we sort of heard 3 design echoes that were idealed over and over again. One was that we be as fair as possible, so making sure that people felt like they could be selected. 2 was that we were inclusive and representative of the community. And then 3 was that we maximize our ability to learn. So that was why we went with 1, an RCT, and doing the full sort of treatment and control group model. It was also why we centered ourselves around the $46,000 number, because it allowed us to reach those in need while also being pretty expansive of the entire city itself. We did consider a couple of other options. I will say back in 2017, the conversation was much different than it is today. So we didn't, as the nation's first mayor-led guaranteed income demonstration, this is pre-pandemic, so cash was definitely not as welcome of a solution to economic inequality. The conversation around the economy was much different. Guaranteed income was still very much something isolated to tech circles. So we also didn't feel like we had the political liberty to be able to target more. So which is why we went with sort of we call our approach targeted universalism.
And Sukhi, can you just run through again? So it's my understanding that it was targeted on communities that earned less than the median income, but anyone within that community was eligible, right? So that means that some of your folks could have earned more than that. And then there was a weighted lottery, is that correct as well?
So the first half is correct in terms of recipients have to live in a neighborhood that was at or below the median household income, but households themselves could make more or less. It was weighted in terms of making sure that our sample was as representative of Stockton's diversity as possible. So we wanted to be racially diverse, ethnically diverse, and also make sure that we were proportionate to the neighborhoods themselves.
Awesome, thank you. And then while we're waiting for more questions to load, feel free to drop them in the chat or raise your hand. You talked a bit about mayors for guaranteed income, and I know that there are several demonstrations coming on board or planned. What are some of the selection criteria that other cities are using?
And Erin, feel free to hop in here as well. It really varies city by city. Sort of harkening back to what I just said a moment ago, because these cities aren't the first, they have a lot more liberty in being a lot more targeted than Stockton was. So in St. Paul, California, or St. Paul, Minnesota, you have Mayor Melvin Carter giving about 150 St. Paul families $500 a month, and he selected from a pool of recipients of his additional program that he's running called College Bound St. Paul. So he is coupling interventions, and all of those families have to demonstrate a COVID-19 impact and have to live in one of the pre-identified low-income neighborhoods. Richmond, Virginia is doing a pretty small pilot. Their eligibility criteria is folks who are making too much to qualify for public benefits, but not enough to really be earning a living wage. You have Compton and Newark are taking a broader approach. It's similar to Stockton's in that it's more targeted around income levels, but much bigger in terms of not having to meet a specific criterion. And then we have a couple of other cities in the pipeline who are looking at serving the reentry population, folks who are previously incarcerated. Erin, do you want to chime in with some other cities?
Yeah, and rather than even talking about what some of the specific cities are doing, at this point, I think one of the goals of MGI and one of the goals of the Center for Guaranteed Income Research is establishing the ways in which guaranteed income works for disparate populations, right? Because at this point, we have the idea that it works overall. And I think, there was a fair amount of research going into this even before SEED that established that it didn't necessarily have negative effects on employment, and then it didn't have, negative effects in terms of, how people were engaging with markets. But we do not have a clear idea at all about how it affects different demographics, about the limits of it for particular populations. When you're thinking about students, when you're thinking about families, when you're thinking about BIPOC populations. So I think the idea at this point, and cities are certainly driving this with their criteria, is getting a better picture of that. Because if this is going to become a viable policy at a national level, or even at like bigger state levels than just cities, we're going to have a much better idea of what those effects are, so that those policies can be written in ways that don't reinforce existing inequality, that take into account equity, and that ensure efficacy. And the reality is at this point that it's too nascent in nature in the United States anyway for us to have a true picture on that. So all of the cities and the ways that Sukhi was just talking about it in terms of the approaches that they're taking are really designed to provide us with a diversity of data, both geographically, right, demographically, and so forth, that will allow us to build better policy.
Thank you so much. Chris, we'd love to hear your question.
Hi, my question is, are you guys getting any pushback about the selection? Because some of what I experienced in the education space with traditional public schools and charter schools is that sometimes charter schools outperform because they're cherry picking their students. Are you getting any pushback that you're cherry picking the families who are getting guaranteed income and the selection process? And because the outcomes that you're reporting are really good, and I'm wondering if you're getting any pushback because if you're selecting families in a certain way that you're kind of guaranteeing certain outcomes, or if that's been an issue for you guys at all.
So you want to start?
Yeah, our pushback actually comes in the opposite way. It's that people are going to spend money on drugs and alcohol. People are going to stop working because the folks who are receiving the money tend to be poorer, tend to be facing economic insecurity. And there's a lot, as we all know, there's a lot of sort of tropes around why folks are poor. People are poor by their own choices. People are poor because they don't work hard. And so the criticism that we receive is in the reverse. And I will say, and Erin can speak to this, on the research side, there's robust randomization that's done that helps curb that sort of criticism and debunk it, because we're randomizing our folks, it cannot be cherry picking. But Erin, you can speak more to that.
Right, and that is actually the tack that I was going to take in responding to this question, which is that because of the way the selection process was designed, that creaming, right, that cherry picking, that recruiting particular people who might be successful given those things, which are absolutely true, you're right, with charter schools versus traditional public school models, is actually baked out of the program, because we have no control whatsoever about who is going to be filling out, and in fact, who is going to be receiving those initial recruitment mailers that invited people to participate in SEED, since it was entirely done by random assignment and building a sample of 4,000 addresses that were chosen at random within the selection criteria of the census tracts, as Sukhi talked about when talking about who was eligible for this. So the nice thing about that design and the nice thing about that random sampling and the random group assignment is that we haven't actually had much pushback at all about whether or not we selected, individual people or people we felt were likely to be successful, because we just can't.
So I'm not seeing any other questions right now. I really encourage folks to do it, but in the absence of that, Erin and Sukhi, I think it would be great to hear more about Mayors for Guaranteed Income, the Center for Guaranteed Income Research, and what are your next steps?
Sure. So as I mentioned earlier, SEED ended, but sort of the movement continues through Mayors for Guaranteed Income. We launched back in June 2020 with 11 mayors, and now have 42 mayors who commit to 3 things. The first is advocating for federal guaranteed income. Second is investing in narrative change work. And third is inviting other cities to join our work. About half of the cities that are in the coalition, a little bit more than half, will be launching guaranteed income demonstrations of their own, which are evaluated through the Center for Guaranteed Income Research. Our goal is really to move from pilots to policy. Pilots are really, really important to, again, as Erin was mentioning, show how a guaranteed income works best, and for who. But at the end of the day, we know that we can't do this as pilots forever, and that we need to scale this into a larger policy. And so our hope is through all the work of the network, we're able to eventually get to a federal guaranteed income. Erin, do you want to fill in what the center does?
Sure. So the center being the centralized evaluation mechanism that MGI is going with in order to ensure that cities have a place to go to get an independent evaluation done, right? Because research is only as good as the structures that are set up that are going to ensure that the data we're getting is in fact being evaluated appropriately, and not with a lens of, okay, we're pretty sure we're going to find these things and we'd like to make sure we find them, right? Because that data is just not useful. It's nice to see, but it's not useful at all. So with that in mind, the Center for Guaranteed Income Research is looking at the ways in which the cities are rolling out these pilots and evaluating the programs that they're setting up, with an idea about informing the dialogue regarding disparate impacts, like I talked about, identifying what outcomes are most affected by guaranteed income, right? What can it actually target? What can it not actually target? And ensuring that questions like implementation and scaling can be answered in a data-backed way. Because I think one of the phenomenal things about American federalism is that policy innovation tends to occur on lower levels, right? It tends to occur in cities and in counties and at states before it filters up to the federal national context. And that's great, but it means we have a real opportunity right now to try things out and see what works best, so that when we are in a position to build this out at a national, federal policy level, we're making decisions that work for the entire country, right? Not just for cities in California like Stockton.
All right, now, Erin. William, I see you have your hand raised.
Yes, my apologies. You may have addressed this earlier, but did recipients have to report their income to other agencies? If so, did it have any unintended consequences on other benefits?
This was exactly where I was going to take the conversation next. The benefits issue is so huge.
Sukhi's the right person.
So we did a lot to protect benefits. We really believe, again, that guaranteed income should be supplemental too, and not replace the existing social safety net. As we all know, the public benefit system, for most benefits that you receive, if you receive any additional cash, you usually end up receiving less of the particular benefit. To prevent that for our recipients and to really make sure it was a net gain, we did about 4 things. First was that we structured our disbursement as a gift. That meant that the entity that's giving the money was different than the entity that's doing the research. So we gave it from a nonprofit that was affiliated with the city, and the research happened through the University of Tennessee. And the participation in the research was completely optional. Folks receiving the dollars was not contingent upon participation in anything else. That gift classification precluded the $500 a month from being counted against certain benefits. For example, for Medi-Cal, under the new MAGI rules, you don't have to report gifts that you receive. We were able to successfully secure a state waiver for CalWORKs by working closely with our Human Services Agency. For housing, so anyone receiving Section 8 or anyone receiving a voucher or living in Section 8 housing, we were able to establish a pretty cool and unique partnership with our local housing authority and establish what we would call a hold harmless fund, where folks who saw an increase in their share of costs were then reimbursed through the housing authority themselves. And so the housing authority actually put their federal discretionary dollars behind doing so. And the last thing we did, because even despite all the steps we took, there were benefits that we couldn't protect, namely CalFresh food stamps and disability. We provided benefits counseling to every single recipient who indicated that they were receiving benefits at onboarding. And through that benefits counseling, we let them know, here's the benefits that are protected, here's the ones that aren't. If you would still like to participate, please do. And if you need to drop out, then please also do that. So really making sure that agency was in the hands of the recipients themselves.
The only thing I'll add to that.
Oh, sorry.
Was just to contextualize it in terms of what MGI and CGIR are interested in going forward, right, is that the United States has, as we were just talking about, a very decentralized model of safety net services where these things vary incredibly from state to state in terms of how they're administered, in terms of how, eligibility criteria works, in terms of how enforcement works. And so that is, a key part of the MGI cities in developing their plans, projects, and pilots is to ensure that they are looking at that aspect of interaction with social safety net benefits, and that they are thinking about the ways in which they can protect some things and can't protect other things, so that that's built in. So that's certainly part of the evaluation going forward too, because as Sukhi said, it really, in order to evaluate guaranteed income, it has to be a net positive, right? It can't just be evaluated as a replacement for other things. Otherwise, you're asking an entirely different question. So certainly the lessons from SEED and the phenomenal work that they did in setting all of this up, is being taken forward.
I have two things to add to that. This is a conversation that's happening in all of the places where guaranteed income demonstrations and pilots are being performed. And the state of Illinois passed a bill protecting state level benefits. So where the state has a say in setting the income or asset benefits, if you're part of a guaranteed income demonstration for 5 years. I know that there's a group in California that has been in real communication because there's so many demonstrations happening in California. And then here at ESP, in collaboration with MGI and the Center for Guaranteed Income Research, Springboard to Opportunities, which has been running the longest guaranteed income demonstration down in Jackson, Mississippi, Stanford Basic Income Lab, and Asset Funders Network, we've recently launched a community of practice. And one of the big questions there is, how do we as a community move forward with this question? Because it is, does every pilot spend this time building relationships and going on their knees with their hat outstretched, asking for waivers? Or is there something that we can do together to potentially create a blanket waiver for all of the demonstrations that are happening? I will say in Jackson that the program there, the Magnolia Mothers Trust, did not get waivers. And so they give the recipients $1,000 a month, and they see a net benefit of between $600 and $700 because they lose $300 to $400 worth of other benefits that they would otherwise receive. And I see that we have a question from Charles. Would you like to unmute and ask? Otherwise, I'm happy to read it out. So Charles asks, did we learn anything from the federal income experiments, the income maintenance experiments in Seattle, Denver, New Jersey, and Gary, Indiana, which I think is very exciting to think about the recent announcement that they'll be launching another demonstration in Gary in the 1970s. Would a national effort help to fill the information gaps you've identified with pilot studies?
Yeah, I'm definitely happy to touch on this. We certainly learned, plenty from both the way that the Simon Dime experiments and others were set up, And, I think some of those outcomes were definitely built into the evaluation model to determine whether or not they hold true now, given that there's been such a significant length of time between when those were happening and the fact that the United States looked very differently economically and otherwise at that time versus how it does at the moment. I think some of the bigger, lessons that we learn from those is the importance of the way the evaluation plays into what you do find out, right? What questions are you asking and the frame that you take on those questions? I think one of the things that we are most proud of when it comes to the evaluation is asking questions that aren't usually quantified, right? In terms of care work, in terms of network strain, in terms of social pooling, to really give us an idea of how GI affects not just the individual who's receiving it, but also the people around them. And so I think the idea really has been for the work that's being done now to build on the work that has already been done, but also to show the ways in which the United States has changed.
Thanks so much. And Chris, would you like to unmute and ask your question?
Yes, we are able to relate the ratio of the benefit to other income to the outcomes. And what I'm getting at is, is there a minimum amount that you feel that based on the data you would have to give in order to have a valid test of guaranteed income?
So not at this point, right? Because we're just so far SEED is evaluating a single interventive level. So we can't necessarily anticipate the ways in which the outcomes are either dose dependent or, right, is it a threshold level? Is it, just the amount? Is it the way the program is set up? Certainly one of the amazing benefits to MGI is that cities are not all using the exact same level. So our hope is to be able to build through this, essentially multi-city RCT, more of an answer to the question of how much is required, right? How much is effective, and whether or not that needs to be taken into account in the way that benefits are provided currently, right? Some are dependent on location or amount, right? Average cost of living. And so thinking about how we talk about dose when we talk about GI is certainly a future research question we're hoping to be able to contribute to.
I am not seeing any other questions here, and I know that we are hoping to end in about 6 minutes to give you all time to head back to the main room. So I just wanted to open it up one last time. Any questions that anyone has, and I would really encourage you all to join me in congratulating the Stockton team on the great work that they've done. So if you aren't familiar with using reactions, I say go for it. Just really wonderful the work that they've done. And I'd like to open it up to anyone with any comments or thoughts on what we've learned and where we should go next with this great work.